Well, I think this is one of the worst scandals in terms of the waste of public money that I've seen in my 10 years on this committee, because not only was what has happened predictable, it was actually predicted. This stems from contracts that were let in 2002 and 2003 at very high speed, without figuring out what it was that the government wanted to buy, and without the computer contractors having a sensible idea of what it was they were expected to supply, and without, crucially, asking the clinicians, the doctors and the nurses and the hospital managers what it was they actually wanted. And then, if you like, setting in aspic a set of contractual arrangements that wouldn't deliver what was required. And all the problems really stem from there.
And at a cost, as I understand it, we're talking billions.
We are talking billions. On the detailed care record for patients, which was the central purpose of this project. It's important to remember that there are other things in the project, some of which were added to it to give a veneer of credibility because they actually worked. Things like digital x-rays, which are very good and worth having, although we've paid through this programme far more than we needed to for them. But the central core of this was the detailed care record for patients, and that has had £2.7 billion spent on it so far, with very little to show for it. I think for anyone watching us, it's inconceivable that we've got this far down the track without somebody putting a stop to it before. It surely wouldn't happen in the private sector. Well, you would hope not. I mean, the private sector does get things wrong in computer projects as well, but they're much quicker at stopping them. The public sector has this habit of sort of, in a Magnus Magnusson sort of way, saying, I've started so I'll finish, regardless of how bad the situation is. And I hope now, this is the third time that our committee has looked at this since 2006, that the government will find a way through. Unfortunately, we've got all these contracts we're tied up in, and we don't want to make lawyers even richer than they already are. And the only good news I can see out of this project at the moment is that the Cabinet Office, the big battalions from the Cabinet Office, are now very heavily involved in the negotiation process to try and salvage something from what's left, from the £4 to £4.5 billion that has not yet been spent, to make sure that something worthwhile is produced from that.
And do you think that can actually happen, or should it actually just be scrapped? Because there's a lot of hospital trusts that have actually just pulled out regardless.
Well, what I would like to see is those hospital trusts who have pulled out being helped with this money to do something useful. You can't blame hospital trusts who were promised this shiny new detailed care record and it hasn't been delivered for trying to look for alternatives, because they've got hospitals to run, they've got patients to treat, and in many cases they had projects that were going quite well that they put on hold, or were told to put on hold, because this was coming along. So you can't blame hospitals for looking for alternatives, but alternatives outside the programme have to be funded entirely locally by those hospitals, and I'd like to see the remaining funds being used to assist hospitals locally rather than being spent through these big central contracts that have not delivered.